Hello everyone, hope you're all well. Welcome to our YouTube channel, and its sole purpose is to provide information and in no way to suggest any treatments for you. So if you need any specialist advice, please contact your nearby specialist and seek their advice. Today we are going to talk about fibroids. So either you have been diagnosed with fibroids, or you know someone who is diagnosed with fibroids and you want some more information. So this video will explain you about what fibroids are, their symptoms, their complications, and management options available. So what are the fibroids? So fibroids are a growth of muscle of the uterus. So if you know, uterus has three layers. So the innermost layer is called endometrium, which you shed every month during your periods. The myometrium, which is the muscle of the uterus, which will expand when you're pregnant to contain the baby, and it will contract when you're in labor to push the baby out. And the top layer, it's called serosal layer, which is a protective covering of the uterus. So according to the research, fibroid is a monoclonal tumor, meaning one fiber is growing multiples of times and developing into a ball-like structure, which is called a fibroid uterus. They are non-cancerous growths. The chances of fibroid turning into a cancer is very small, less than 1%. Their other name is myoma. They vary in size from as small as a pea or even smaller sometimes, or sometimes they can grow up to a size of a football. And their effects will depend on their size and their location. Their management will also depend on the symptoms you're having, their location, your fertility aspirations, and secondary complications due to the pressure effects of the fibroids. The true incidence of fibroids is not known because not everybody is going to have a scan, or by the time they have scan they would have already been diagnosed. So it's difficult, but they suggest that probably 1 in 3 women suffer from fibroids or have fibroids, but they are too small to cause any symptoms. And the women of Afro-Caribbean origin are at a higher risk due to their genetics, and the women with high BMI, as estrogen is linked to the development of fibroids, although exact cause of development of the fibroids is still unknown. Now, what are the symptoms of the fibroids? So the common symptoms are heavy or painful periods, abdominal pain, lower back pain, increased frequency of urination, constipation, painful intercourse, subfertility, and other symptoms due to the pressure effects or complications of the fibroids. Now, there are 3 types of fibroids. So as you can see, this is the uterus. This is the lining of the uterus. This is the muscle layer, and this is the top layer, which is a protective covering. So the fibroids, which are into the cavity or just below the level of the lining of the uterus, they are called submucous fibroids. The ones which are in the wall, they are called intramural fibroids, and the ones which are going outside, they are called subserosal fibroids. And now you can see why their size and location would vary and cause different types of symptoms for you. Okay, now the ones which are into the cavity or just beneath the endometrium, the submucous fibroids, they will have a direct impact on fertility. The ones which are intramural, as you can see, this one, it's blocking and kinking the tube. So these ones will not have a direct impact on your fertility, but they will affect the passage of sperm and embryo and affect the fertility. The ones which are going out of the uterus, they will not be causing any effect on fertility, but based on their size, they will affect other organs like bowel or bladder or ureters based on their location and cause pressure effects. The one in the cavity as well as submucous fibroids, they will affect your periods, they will affect the implantation, and sometimes they will be causing issues like miscarriages because of the implantation difficulties. Now, how do we diagnose this? So the ultrasound scans are quite amazing, especially if fibroids are not too big. So it could be an abdominal scan or a vaginal scan, and we can see and measure the size of the fibroid as well as their location. If they are bigger and they're difficult to be measured on ultrasound, then CT scan or MRI scan we use for fibroid mapping, as it helps us to plan the surgery. On hysteroscopy, we can see the fibroids which are into the cavity or the submucous fibroids which are below the lining and popping into the cavity. And obviously on laparoscopy, we are looking at the uterus, so we can see the fibroids which are on the outside of the uterus. What are the complications of the fibroids? So anemia because of the heavy bleeding, pressure symptoms, either they are irritating the bladder or rectum or ureters, subfertility by affecting implantation or transport of sperm or egg, and miscarriages. Again, submucous fibroids are particularly notorious for this, and pregnancy complications where the placenta can get stuck to the fibroid, leading to placenta accreta and percreta. So what are the treatments available for fibroids? So tranexamic acid and mefenamic acid are mainly symptomatic treatment to reduce the blood loss during the periods. Combined pills will have the same effect. Progestogens are known to reduce the size of the fibroids. GnRH analogs like Zoladex, which will shut down your ovaries reversibly and reduce the estrogen levels and affect the fibroids from growing. Ulipristal acetate is a medication which is known to reduce the size of the fibroids. However, you need to remember that all the medications which are given to you, they are only supposed to shrink the fibroids to a certain extent. So say for example, if one has 10 centimeter fibroid, with these treatments it might shrink down to 8 or 7 centimeters, but they are not going to make them disappear forever. So surgery is the mainstay of the treatment, but again, it will all depend on the symptoms of the patient. There is another modality available, which is called uterine artery embolization, where they pass a catheter, locate the vessels feeding to the fibroids, and block them with a special gel, which is supposed to shrink or reduce the blood supply to the fibroid, and hopefully it degenerates and get reabsorbed by the body. However, it has been shown to affect the blood flow to the lining of the uterus, and that's why if your family is not complete, probably uterine artery embolization is not an ideal form of treatment. Myomectomy, where we open the uterus and remove the fibroids. It can either be done as an open procedure or a laparoscopic procedure or a hysteroscopic procedure, again depending on the size and location of the fibroids. And obviously in cases where it is not needed or the symptoms are getting really worse, then obviously hysterectomy is the option. I hope you like this information. If you like the information, please subscribe to our channel and help to spread the word. Thank you.